Now, women of reproductive age now have more family planning options with the launch of a self-injectable product which one can use in the comfort of their own space. The product, DMPSSC, manufactured by Pfizer, offers a 3-month protection and will be sold in private pharmacies.
Family planning products and services for the general public were mostly offered in public hospitals, but health stakeholders have now embraced a total market approach by bringing on board the private sector to offer these services. On Friday, Philips Therapeutics Limited, in partnership with other development partners, launched a self-injectable contraceptive which will be sold in private pharmacies.
There are always a number of options that are available for women, but one of the important innovations that we have seen in the last few years has been what we call this long-term protection. The product that we are launching today into the private market, because it's been available within the Kenyan market, is known as DMPSSC, and it's a self-injection which a woman is able to use to get contraception, and it gives protection for 90 days.
First, we go to pharmacy because we trust our pharmacies. They are our healthcare providers' first point of care. However, it wasn't the case for family planning. So with Ministry of Health policies in place, the Pharmacy and Poisons Board both represented here, we've been able to get those policies in place, trained pharmacies to offer quality family planning.
According to the CEO, Newton Ciele, the product will increase access to family planning commodities within the private sector, which contributes 40% of the healthcare services.
Over the last couple of weeks, I would say months, that we have seen has been reduction in terms of funding, even in the public sector. So it has, of course, meant also it's very important to have such products being available within the private sector, so that the patients who cannot be able to access through the public sector can also get it in the private sector.
Over 500 pharmacists in 10 counties of Kiambu, Mombasa, Nairobi, Uasin Gishu, Kisii, Kericho, Kisumu, Narok, Meru and Nakuru have been trained to offer quality family planning services to the 57% of women in the reproductive age bracket.
For injectable contraceptives, the ministry changed the policy way back in 2019 so that pharmacists are now allowed to offer injectable contraceptives. And we support the initiative as Pharmacy Board. We collaborate with partners to ensure that those who are offering the service are duly trained. The premises where they operate have adequate provision.
The Ministry of Health has lauded the initiative, pledging the government's commitment to providing quality family planning services.
Well, the women who are supposed to use the overall reproductive age, who are supposed to use, who are willing or they have a need to use family planning products, we have reached a coverage of about 57% as a country. Though we still have about 14% who cannot access. And that is therefore where we have a challenge as a country.
Head of Reproductive and Maternal Health, Dr. Edward Serem, says the ministry has kicked off talks with different partners after a section of development partners halted funding.